welcome to Changing Healthcare, an exploration of people and brands that are disrupting healthcare for the better. And today I'm joined by Brian Manning of PatientPing. He's the Senior VP and Head of Growth for the company. And we're going to learn a little bit about how healthcare providers can get real-time updates about patient utilization of services. And this is something that will help prevent costly mistakes and also improve the coordination of care and even make a positive impact on revenue as well. So I'm super excited to talk about this. Brian, thanks for joining us.
Thank you, Patrick. It's great to be with you today.
My pleasure. So can you tell us a little bit about how PatientPing got started?
Sure. Yeah. So PatientPing is a care coordination platform that allows healthcare providers to seamlessly coordinate patient care. It's a lot of buzzwords, but the problem that we're actually solving is that patients are seeing a lot of different healthcare providers. And those healthcare providers work for different companies. They're in different geographies. They have different payment incentives. And as a result, if you're a sick patient, you're seeing 5, 10, 20, 25 different providers in a year. It gets really uncoordinated. And all kinds of bad things can happen as a result. So you get duplicate procedures being done, patients staying in the wrong setting for too long, even ultimately, unfortunately, patient harm. So we built a platform that really solves that problem. It brings providers together into one place so they can share information and avoid, prevent a lot of these bad things from happening. The company was started about 6 years ago by a guy named Jay Desai, who's our founder and CEO. And he was actually working for Medicare. So he was working at the federal government for CMS. And part of his job was he was writing some of the rules around this shift from fee-for-service to fee-for-value, where providers get paid based on keeping their patients' costs down and keeping their patients healthy. And one of the things he kept hearing from the people, from providers across the country, was that, hey, Jay, this is a great idea, but in order to do this, I need to know where my patients are. I need to be able to collaborate with the providers that are actually treating that patient in real time. And Jay looked around for a variety of different solutions and felt like this needed to be a company, that this problem was big enough that he needed to build a company around it. And so that's what he eventually did. He moved from Washington or Baltimore area to Boston and launched PatientPing. That was about 6 years ago. And we've grown quite a bit since then. We now operate this product in about 25 states. We work with about 1,000 hospitals and counting, and lots of different providers across the country.
This is really, really fascinating. So, and you think about the whole value-based care equation, how can providers reduce costs and make things more efficient when they don't even know precisely when their patients are seeking care anywhere, right?
Right. Exactly. That's the problem. That's the problem we're solving. Yep.
Okay, so hospitals are getting a lot of pressure from payers about unnecessary readmissions and duplication of services. Can you give us a little perspective about how big this problem is today? Like, how expensive is this?
It's big. It's really big. So there's lots of different data on this. The last data I saw on this is that it's about that Medicare alone spends about $30 billion a year on readmission. And so when I say readmission, meaning the patient leaves the hospital and then comes back to the hospital within 30 days and gets readmitted. And that's $30 billion. And they think about 20 billion of that is just unnecessary and could be avoided with better coordination and better follow-up after the patient is discharged. And again, this is just Medicare. Medicare covers about 15-ish% of the population. And this doesn't include Medicaid, it doesn't include the commercial plan. So it's a really, really big problem. And so as a result, as I'm sure you and your listeners know, CMS has started to actually penalize hospitals that have these high readmission rates to try to get them back in line, which has then launched a lot of care coordination activity that happens before the patient gets to the hospital, while they're in the hospital, when they leave the hospital. And what they don't have is, unfortunately, these providers, these care managers that are trying to avoid these readmissions, but they don't have as great tools to be able to do it, which is sort of another reason why we've been able to grow so fast, because we help those entities and care managers solve that problem.
Yeah, I mean, even just like that's a staggering number just pertaining to just 15% of the population. So, this is really amazing. So, can you tell us a little bit about how the platform actually works? So, PatientPing sort of keeps providers up to date in real time about what patients are doing. Can you give us a little perspective on how it actually functions?
Sure. The two core products that are in market now are pings and stories. And so pings is a ping is tells healthcare providers where their patients are in real time. So if a patient, if I'm a care manager or a primary care provider and I'm responsible for the cost of care of this patient, or I'm just on the care team of this patient, when the patient goes to the emergency department, we'll send a notification to let the entire care team know that that patient had a healthcare event. If they get admitted, we'll send a ping. Discharged, a ping. Deceased, a ping. If they go out and they're going after surgery, they go to a skilled nursing facility, we'll send them a ping. When they get discharged, a ping. When they require home health services, we'll send a ping, and on and on and on throughout the patient's journey. And so what it's really doing, the ping, is really notifying the care team that something's happened and then giving them an opportunity to collaborate with those that are treating the provider in real time. So to make sure that, as I mentioned at the beginning, all of those issues around the patient being in the wrong setting, staying in the wrong setting for too long, duplicate procedures, all of those things can be avoided drastically, reducing the cost of care just by sending a simple notification. The other product is actually for the provider that's with the patient. So pings are if you're not with the patient. Stories, we call it, if you are with the patient. That's delivering real-time context to help that healthcare provider make better decisions. So maybe that patient comes in the emergency department, they have dementia, they can't describe who's on their care team, they can't describe their primary care provider. We'll flash up real-time information in our application or in their EHR to let that provider know that, hey, this patient was just at a skilled nursing facility. Maybe the best thing to do for them is to send them back, and why don't you collaborate with that skilled nursing facility? Or they have a home health nurse. Here's that nurse's phone number and contact information. Or here's a set of past diagnoses that'll help you ask better questions or help you point that patient into the right direction. And these things are, again, avoiding readmissions, getting the patient right to the right setting, engaging the care team of this patient to make sure that they're getting the best care at the lowest cost.
Beyond just like the mitigation of costs and elimination of waste, it seems like from a provider perspective, this sort of visibility also can sort of help them with patient retention as well, right?
Oh, absolutely. Yeah. I mean, one of the challenges, that we're solving is these, patients are bouncing from different provider to different provider, and again, different company to different company. So these providers that are treating these patients literally work for different organizations. They literally work for different companies. And one way to prevent that is to have more insight about your patient, know more about your patient. It's funny, I was talking to a primary care provider recently, and he was saying that one of his patients came in, an elderly patient came in, and he said, "Oh, hey, good to see you again. How are you doing?" And the patient said, "Oh, well, I had hip surgery 2 weeks ago." And the primary care provider, like, really? Like that I didn't know, that's crazy. And obviously that primary care provider can't make sure that patient's getting the right follow-up care and seeing the right, going to the right rehab, et cetera, because they simply didn't know. And so, it's very difficult to do, good, to create loyalty among your patients when you just don't know what's going on with them. So we do find that this is a great tool to keep patients coming back to you, to keep patients, if you're a primary care provider, care manager, and you're sort of quarterbacking the care, this kind of insight builds trust and then allows you to do that a lot more effectively. So no doubt about it.
Sure. And, on that point about trust, I mean, when you're dealing with a lot of patients with memory care issues, I mean, this sort of lack of transparency, that comes before your platform is kind of terrifying, right? I mean, I can only imagine that there are some instances where PatientPing has actually helped prevent some serious mistakes from being made, especially when you're dealing with a patient who has dementia or maybe Alzheimer's.
Absolutely right. Yeah, no, absolutely. That's a huge area. And that's really where we are helping the most. We've got a variety of kind of customer testimonials talking about specific patients. And where we see most of that impact is really those patients that need it the most. Again, comorbidities, elderly, frail patients with dementia, even, many of them have drug and alcohol issues, behavioral health issues, and those are the patients we're helping the most.
Sure. So let's talk about the patient experience, sort of beyond that. So when people have to see multiple doctors about an issue, they go to the hospital, then they might have to go to a skilled nursing facility or some other, provider, and they have to describe the same story over and over again. It can be frustrating. Like, I think most people have been through this before. Sometimes even in the same hospital, they have to give the same information over and over again. So what sort of impact have you heard from some of your customers about the patient experience?
Yeah, absolutely. Yeah. And so it does improve the patient experience dramatically, which again, improves loyalty, and which ultimately lowers cost. And, the challenge again is that these patients these providers are working for different companies, and they're on different software systems that don't talk to one another effectively. So they can't see the same information, and they definitely can't see the same information in real time. And so building a platform like PatientPing that has connected all of these different disparate systems creates a ton of value, both, obviously in terms of lowering costs and improving quality. But again, going back to that earlier point on retention, improving that patient experience, so you actually know what's happened to this patient prior to this encounter. Again, that example of the provider that didn't know about the hip surgery, yeah, it dramatically improves the patient experience and ultimately loyalty and cost of care.
And can you give us an example, like any sort of remarkable story about how this sort of data sharing has actually prevented a serious mistake from happening, or any other sort of huge impact on a patient's care?
Well, yeah, we have a memorable quotes channel in our version of Slack that our operations team is constantly posting patient stories in, and so it's great. It's really gratifying, I think, for our entire team to see those stories come in nearly every day. But one that really, I think, hit us all kind of hard recently was a patient that was in a foster care program, and that patient, the child had a care manager, and the child was taken to the emergency room with some injuries. The care manager, by virtue of PatientPing, received a notification that this patient was at the emergency room, went to go see the patient, and learned, unfortunately, that foster care situation had turned abusive, and that the child was actually being abused. And the care manager was able to quickly contact the state authorities and get that patient moved out of that foster care situation and into a new situation and a healthier home. And so, that's just obviously a really kind of a great example of what this can actually do for people, right? And the actual person that's feeling the impact of this kind of information being shared across provider organizations. So I think that I could give lots of examples, but that was one I think that particularly hit home for a lot of us here.
Yeah, that's incredible. I mean, and it's very possible that child's life was saved because of that.
Absolutely. Yep. And a more practical example that we see on a daily basis is a patient, several times on a daily basis, unfortunately, are these patients that are using the emergency department as their sort of primary care office, right? And because they don't know where else to go, they don't have a way to get somewhere else, and that just drives up cost, and it's bad for them too, because they're in the wrong setting, and you have these providers that don't know anything about these patients. These are high utilizing patients that are coming back to these emergency departments for care, and often the providers don't know what to do with them, so they'll admit them, and then they get them into the hospital, which is not really not the place you want to be. There's an old saying that the longer you stay in the hospital, the longer you stay in the hospital, and so it's the best thing we can do is get those patients out. So I was talking the other day to a customer of ours in Michigan, who is a medical director, that is sitting there all day watching the ping feed, and as the patient hits the emergency department, this person is looking up their file, calling their medical record, calling the emergency department, saying, "Hey, you've got our patient In this case, this patient, they show up at the emergency department frequently because they think they're having a heart attack, and in reality, they're really just haven't taken, they're on a variety of anxiety medications. They've probably fallen off their prescriptions. That's likely what's going on with them. Let us send a nurse down there, talk to the patient. Don't admit the patient yet, because we don't think that we're not sure that they need to be admitted. Now, of course, if they need to be admitted, they'll be admitted. But if we're not sure, let's come talk to the patient and see if we can get them back on their meds. And that's when they do that, and they do this several times a week, that then gets the patient to a better place. They can get them in for a primary care visit, get them to see a behavioral health specialist, whatever it is. It gets the patient out of the hospital, which opens up a bed in the hospital for another patient, and then saves, Medicaid or Medicare, whatever program this patient's on, literally thousands, tens of thousands, in some cases, hundreds of thousands of dollars, by getting them in the right place. So those are the examples we hear literally, all the time.
That's great. And then just so that I'm clear, like, you've got a hospital and a skilled nursing facility that need to be able to communicate back and forth and get these pings. So does both facilities need to have your platform installed, or how does the sort of pollination of data sharing work within your platform?
Absolutely, yeah. And so all the facilities that are in the PatientPing network are PatientPing customers. Now, we don't charge them all. So any skilled nursing facility, hospital that would like to share their data with our community, and there's lots of reasons, there's lots of benefits to doing that, we don't charge at all. So we make it really effortless to sign up. We've got a simple contract, business associate agreement. We create a connection generally directly with their EHR to get them set up right away. And so we have a kind of a policy here. Anybody that is sending information that wants to share with their fellow providers, that we're not going to charge them for that. If they'd like to receive the pings, the stories, some of the other products I mentioned, there is a fee, which again we try to keep nominal, because this for us, this is a volume game. We want to have every provider in the country on this product. It's not to make a lot of money from any one particular customer, but yeah, they have to be a member of the community, and we make it really easy to get going. Awesome.
How can people learn more about you and about PatientPing?
Sure. So we're all over the place. So we're on all the social media sites. I think probably the best one would be Twitter, where it's just @PatientPing. You can find us there. We also obviously have a website, that's obviously PatientPing.com, where we have a blog that we're updating every week with new content from our customers, case studies, white papers, all kinds of stuff. So, you can sign up for our email newsletter where you'll receive those things. So PatientPing.com, that's the best place to find it.
Brian, thank you so much for speaking with us today. I really appreciate it.
My pleasure, Patrick. Really enjoyed it. Thanks so much.
You bet.
Changing Healthcare is a production of Creative Side Marketing. Are you struggling to get trackable ROI from your website content? Trying to boost the number of quality leads for your sales team and provide an amazing customer experience? At Creative Side Marketing, we work with healthcare brands who believe in what's possible and help them disrupt for the better. Let us help you grow using inbound marketing and customer experience solutions. Visit us at creativesidemarketing.com to learn more.